Welcome, Head Start community. My name is Simeon Russell. I'm the executive officer of the Maryland Head Start Association, and this is our inaugural, right, Yvonne? Inaugural podcast that everyone asked for. So here we go.
Right, that's exciting.
Yeah,
That's exciting.
we have. Well, let me swing it to Yvonne.
Hi, everybody. I am Yvonne. I'm with the Yvonne Bellamy, with the Maryland Head Start Association. I am the operations manager, and we are very happy to join you today.
Good afternoon. I'm Corey Boland, the newly elected board chair of the Maryland Head Start Association, and likewise, I'm excited to be here. Excited about my new role, the association.
Yeah, and we don't really know what we're doing right now, but we're just gonna go for it. I guess we can talk a little bit about the association for anyone who is not aware of the Maryland Head Start Association, who we are, what we do,
why we do, and who we're looking to have join us.
Yeah. Well, let's start with the association. We work for you, all of our Head Start community. You know, from the Eastern Shore to Western Maryland, all of our staff, parents, children. We advocate for you on a legislative level, federal, state, local, and we put on institutes and conferences and do workshops and trainings. And we're here to support you any way we can. As a matter of fact, we're currently at the Health Institute.
Health, mental health, cohort, networking, institute, because it changed. It used to be the Health Institute. And then when a couple of years ago, they changed the Health Advisory Committee to be the Health and Mental Health Advisory Committee. It used to be HSAC. We decided we were already bringing mental health things in with our Health Institute anyway.
Right.
We decided to make sure it became very inclusive and named the Institute after it. And then to bring that whole cohort theme and networking into it, because that's, very important.
Right.
That people feel connected and networking.
Right. Our goal is actually to have network cohorts in every Head Start component so that our staff can connect with each other, learn from each other, share resources, etc. Corey has,
well, correct. And one of the things that I've shared with Simon and Yvonne for a number of years is that I feel the association should be the resource guru for our programs in the state of Maryland. We would like to, in a perfect world, be able to say, yeah, if you need it, we can find it. If we don't find it, I don't have it, we'll go find it for you. But we would like for you to be able to turn to the association for questions big and small, whether it be programmatic, monitoring, fiscal, whatever the case is. We would like to be a resource for our programs in Maryland first before you have to go outside to find anyone else.
One of the ways that we are growing is our name.
Yes.
Right. I don't think anyone knows besides the board, right?
Oh, okay. We didn't release that.
Yeah, we didn't release it, but I guess we're gonna do it now.
I guess we are
on our inaugural podcast.
Yeah. So our name is changing. I guess what did we say? August 1st, 2026. Our name is going to change. We'll be known as the Maryland Association of Head Start Programs. We've already gone through the legal process of changing the name, making sure we're a 501c3 under that name, and so on. So now we're just working on the rollout. But what do you think? I spoke to someone, I don't remember who it was, and when we were with TNTA, and we spoke about the name change, and she said she felt that name was a little more powerful and inclusive. Do you think, Yvonne?
I agree, especially jokes aside, if you would Google MHSA, sometimes you would get the Maryland Horse Society.
The Maryland Horse Association
association, and then Massachusetts also.
Yeah.
So I think I think it helps people to understand, because sometimes people would see Maryland Head Start Association and think we ran Head Start programs.
Right.
And so I think it's more in line like the associations that for lawyers or real estate agents or stuff like that, that it gives more of lending to the understanding.
Yeah.
Right. And I think too, with our new vision, our new branding, new purposing. So starting with a new name, getting us out there and away from the horse people is going to help us. Because one of the things that we also are looking to do is attract membership and participation. While we have all these ideas about changing the association and trying to be resource ready, but we can't do it without support of our programs in the state. So one of the things that I also see us doing is reaching out to the programs who are not as participatory with the association or ones in the past and say, hey, what's happening here? Why aren't you coming? What can we do to get you to come? What do you need? And try to build a membership in that capacity as well.
Yeah. Yeah. So it's the Maryland Association of Head Start Programs. We're still kind of,
Working on the
acronym, if it's going to be called MAPS. I like MAPS.
The same thing they did with the HSAC. Because what's the acronym for Health and Mental Health Advisory Committee?
Oh,
there's no.
Yeah.
I mean,
So,
I like MAPS, because kind of leading the direction.
Yeah. What do you like?
Maps.
Maps. Okay.
MAPS. I know Yvonne is like, yeah, but what about the H?
It's silent. Maps.
Right. My role is to push,
Uh-huh.
right, to make sure that we can explain things to people. So, yeah. But with us being at the Health and Mental Health Institute, right, there's just been so many good things that have happened here for the last couple of days. And so we haven't even told them about the logo, the new name change.
Well, no. I mean, we're talking about the new name change, but there's going to be a new logo with it.
Yeah,
Yeah. So new branding, new materials coming out for us. We're excited about that.
Yeah. So the rollout will be going on throughout, kind of starting now until October.
Yep. Everything will be changed over by then.
Things will be changed over by then. It will be known as.
Don't say it.
MAPS.
The map people.
MAPS.
Map people.
And then, of course, we have some changeover in leadership, right? We have some new leadership. Corey is our new president. And we have not an entirely new executive.
Abby.
Abby.
Abby's our secretary now.
Mm-hmm.
Abby is from Garrett County.
Yeah.
Lauren was the vice president last year. She's the vice president again this year.
Right.
She's a friend on the board. And we still are looking for a treasurer.
Still looking for a treasurer.
Right.
We may have one sitting to our left. But
right.
We'll see.
We do.
Not this guy.
I know. To my left, you're right.
Yeah. We still have some openings on the board.
Right.
Right. And so one of the exciting things that just happened is we just did a vote with our membership, and we're actually opening up a seat on the board to a community partner. So we used to have a seat that was for the EHSCC person, and then we were having a hard time filling that seat.
Can you just pause and explain what that is?
Yes, sir, I can. There will be a link to Head Start acronyms at the next podcast.
There you go.
That'll be 5 pages.
Yeah. No, we actually do it at our program governance.
Yeah.
EHS, Early Head Start Child Care Partnership. And there's only really 2 programs in the state that do it. Right? Lloyd Center does it, and another program does it. But anyway, we was having a hard time filling that seat, and we're always looking to grow. We do have 1 seat for a child care provider, whether it's center-based or family child care. And so we put out to our membership, like, can we open that seat to a different community partner? And the membership voted and overwhelmingly said yes, 97% pass. And so we will be looking to fill that seat with either somebody from the Judy Center, a Patty Center, if you work for a community school for that grant, though, and someone who works for the early childhood mental health grant, a recipient of that.
Right.
So we will be able to fill that seat with another community partner, which will bring tons of
I
ideas,
was about to ask you, so
resources.
what's the significance of having that spot
Yeah,
open for that?
tons of different ideas, resources. But one of the good things that will also happen is when those people are in other spaces and a question may come up about Head Start, they would be able to explain Head Start a lot better or different.
Adequately explain it.
Adequately, right.
And
So
one of the things that we were just discussing with my hopefully treasurer colleague to my left is that sometimes when we work with the school system,
keeps acting like she don't hear you. Go ahead.
Sometimes when talking with the school system, the understanding of Head Start as it operates is not a deep enough understanding to understand that we don't have the flexibility to bend and weave like they do. We don't control our grant situation. It's written in stone. Your funded enrollment is what it is. Your budget is what it is. Your operational situation is what it is. Whereas the school system has more flexibility to adapt and change as they need to. And they're like, well, can't you do that? No, can't do that. Can't change my numbers. Can't change my location that easily. Can't afford to do this because this is all I got in my budget. But I think will be most beneficial if we can start to have those conversations with the LEAs about what we do and how we actually have to do it. So when they start making decisions, they're not making decisions in a vacuum because, oh, we'll do this. Well, you left me out, so I'll sit on the sideline for this go round because I can't do anything with that. If you decide to add more slots at the 11th hour. Well, you just knocked me out the running because I need to get those kids, but all right, we'll just sit on the sideline. So it would be nice to be able to have a seat at the table.
It would. It to be really good. And we're pushing on that. And we're always looking at different ways to introduce people to Head Start. There is me and Samantha one time talking about attending the Maryland Principal Association conference. Sometimes there's one level that's making the decisions. Sometimes if you have cheerleaders on a different level.
That's correct.
Right? Because principals run the schools, right? So we're always looking at different ideas to make sure that people have a good understanding of the partnership of Head Start. Besides Blueprint, we were good should have been good partners before that. So, but
well, maps will give us a direction.
We'll follow our maps. Right. Follow our maps.
Look, Corey made her leave.
Right.
Get up and walk out of here. She don't want to hear anything.
So we do have some seats open. If you go to our website, md-hsa.org, you'll be able to see the additional seats that we have to fill. We'll be hosting a special election probably in March. Excuse me. And we also just keep an eye out because we ask people to register to vote so that we can send you a voting poll. So if you're a member, we need you to register to vote. So this has been an exciting first day, though, for the incident. It has.
Yes. Sure.
Yeah.
I think the other thing to point out in our inaugural podcast is that also we have support from MSDE.
Oh, yeah.
Who we were fortunate to have Vanessa join us today.
And Christian.
That's right. Can't forget about Christian. So both members from the office, our liaison office, and MSDE were here today. And to me, that speaks to the relevance of what we do, why we do, how we do, that we also have the ear and the support of MSDE to try to help make sure that Head Start is included in a lot of things that go on within the state. But we know from the inside out, we have a lot of work to do to make that support stronger. And Vanessa's committed, Christian's committed. But again, it's going to take all of us in our new map situation to make that work.
Oh my goodness.
That was smooth, wasn't it?
Yeah, it was.
I also want to do a shout out to two people, to Teresa Booker and Brandy Green, because Brandy has been talking about podcasts for a very long time. And then Teresa threw it back out there again. Okay, so as I was saying, this has been a great first day of the Institute. We're at the Maritime Conference Center, where we host this every year. And this year, the theme is breaking barriers. And we're broken down into 3 different days, 3 different conversations. So the first day, was oral health and maternal health. Tomorrow is going to be mental health. And on the third day, it's going to be about setting goals. breaking barriers in their area. We had someone this morning, very great presentation about oral health, how to help families, about the staff here, about the people here understanding different things that happen in children's mouths, adults' mouths, to be able to explain that stuff. And then this afternoon we had doulas for dads. And it was talking about the support system.
The importance of
the importance of the support system.
Correct.
Right. It was really good.
It was. That was.
Yeah. The presenter this morning was from Oral Health, MSDE, and the presenters this evening was from the Howard County Health Department. Okay. And it was really good. We're gonna probably invite them to join a podcast.
That's a good segue, because I was just gonna talk about what kind of content we'll have on the podcast, what kind of guests we'll have on the podcast. Our focus really is to bring issues, to discuss issues that are happening in the Head Start community, especially when we have hot topics. And to bring in people who are very knowledgeable on those topics, who can give us information. We're definitely going to need, questions from you. We'll invite just, staff, parents, to come and share their stories and how Head Start has impacted them. We'll bring in, hopefully we'll get the governor, and more.
That's funny. The governor and more.
Come on. Yeah.
He meant to say Governor Westmore, not and more.
I think he was saying the governor and we will do more.
And we will do more. That's what I was saying.
He left out like
I left all of that.
And what we have had.
He needs to fix his name.
Did we? Well, was it during COVID when the senator on the Zoom one night? We got Senator.
We've had Von Hollen a few times, but just recently with the shutdown, Senator Von Hollen did not a podcast with us, but he did a
Zoom.
town hall meeting.
Town hall meeting.
So yeah.
So we want to bring exciting guests here, people who are knowledgeable, about issues that are taking place in our community, but also some fun guests and stories that will
more fun than
inspire us.
Can't be more fun than us.
Can't be more fun than us.
But one of the things that we do see with this podcast is a way for us to remain relevant, tied to our membership and to the issues that are in our, I want to say service area from a work standpoint for Head Start, but within our service area, in our map.
Oh my goodness.
It just fits, right?
Come on.
What I was thinking about?
It just works.
We have 3 different levels of Head Start here.
Yeah.
Corey's, what's your mom do, Corey?
My mom?
Somebody was a pioneer in Head
Start. My great-grandmother. So really quick. When Head Start started on the eastern shore of Maryland, in a town called Berlin, that's my hometown. And my great-grandmother was the first Head Start director in Berlin. So 55 years later, I'm in her footsteps. Never ever imagined. But my dad also worked for Head Start for 35 years. So it's been in my family forever and a day. Again, which would have never, ever imagined that I'd be doing what she was doing and then some.
Right. Then we have the next level.
And I was a Head Start child. Yep. And as a matter of fact, it made such an impact on me that for years into my 20s, any type of early childhood program, I called it Head Start. I didn't know anything else. It was Head Start.
Yeah.
Kind of like Xerox and Q-tip.
Right.
Exactly. Right. Exactly.
And then I would be that next level. I was a parent in a Head Start program. My youngest child went through Head Start and shaped so much of what I learned about early childhood and data and just so much. Like, yeah.
I never realized that. So that's interesting. So off the record, I've been hanging with these two for the last 8 years. It's almost like when we first met, it was almost like we knew each other from before. Now, another podcast, I'll tell you all about Yvonne and my connection, but right now we'll keep that to ourselves. But the relationship has just grown over the years. The conversations, and I'm the kind of person where I don't always lend my name to things I don't believe in. But working with these two, I believe in the mission and the thing they set forth. So I'm in hook, line, and sinker, and I've been tied to them, even off the scene sometimes. Like, what are we doing? What are y'all gonna do? Well, hey, I got an idea for you, that kind of stuff. So I'm excited now to be able to work with them in this capacity to help push the association to that. Again, I'm trying to get to that next level where we're relevant, we're current, we are active, we are participatory, we're recruiting members, we're getting the programs to be a part, that want to be a part, to see the value in being a part of the association. So just keep looking for the good things to come. We are full of ideas, full of energy. We just need your support.
Ladies and gentlemen, we are back. We're in the last day 3 of the Health Institute.
Health, mental health, cohort, networking institute.
I did that on purpose, ladies and gentlemen, so that I could cue and we could put some focus on the name of the institute. But
it's a mouthful.
It is.
It's a mouthful.
Do we have an acronym for that?
No.
I mean, we just found out HAMSAC.
It's the new acronym.
That doesn't even sound good.
But it's a new acronym for the Health and Mental Health Advisory Council. Is it council? Committee. Yep. Because we were wondering what the acronyms were going to be, since it used to be HSAC. It's HAMSAC. Yeah. You gotta love Head Start. We are full of acronyms.
Yeah.
Right? Every industry has acronyms.
Oh.
So, don't pass out. And
go ahead, say that again.
Every industry has acronyms, and Head Start is no stranger to acronyms.
Right.
So this is why during our program governance, we always give out a copy of acronyms. Yeah, right. Because it's good people know what you're talking about. Even though you try not to use them, you try to say the whole word, but sort of an insider thing.
And some things are so many words.
Right.
It's hard to say so many words, especially if you're in a meeting and things are going. You just want to be able to get to the point.
Right. And so even there's one that's an acronym that nobody ever uses the acronym except they're writing it, and they always use a little short word to talk about it. The performance standards. Everybody just calls it the standards.
Yeah.
The standards.
The standards.
But they'll write out the HS. Right. We'll write that out. Nobody writes out in the thing the standards.
Right.
But when we're talking about it, we say
the
standards.
Yeah.
So not only you have to learn the acronyms, you got to learn the short words.
The short words. Nicknames.
Right.
Yeah.
Yeah.
Industry talk.
Yeah.
Head Start industry talk.
Yeah. It's cool though.
Yeah. I mean, when I first came into Head Start, there were so many acronyms and words that I didn't know existed. I was lost for a couple of weeks, trying to figure out everything. But
should definitely give new staff acronyms.
Yeah.
Oh yeah, you feel like a pro once you learn them.
Yeah, you learn it. Yeah, you feel like you know something.
There's the tricky one.
You do know something. You do.
Right. There's a tricky one though.
What's that?
ADA.
Oh, ADA. Right.
Tricky.
And ADA is going to depend on what field you work in.
Right. And what you're talking about. Right. Because we always throw that out during our program governance training. And we go, what does ADA mean to you? And almost 100%, even staff will say American
Disabilities Act.
Right. Meanwhile, every week you're looking at your average daily attendance.
Yeah.
And trying to hit that 85.
Yeah. Trying to hit the 85.
Yep. Acronyms are important. Knowing what you're talking about, because that's what we stress during program governance.
Right.
That you got to know what everybody's talking about.
Yeah. You got to know what it is. If you don't know the definition of these things, then you can't be much help when it comes to putting in input.
Yeah. Even some people say shared governance, program governance.
Program governance, shared governance.
So we use both words in our thing. We say program, parentheses, shared governance. Yeah.
So how do you think the Institute's going so far? Well, we're at the end of it. We're 90% of the way finished, but how's it
all
going?
the surveys and feedback is phenomenal.
Yeah.
We breaking barriers, and every workshop has been about breaking barriers. But even more important, the cohort networking part is after every workshop, we do a networking session where we talk about what was just talked about, and making sharing. And we put out a couple of questions, and people answer so a question could be from what you just heard, and then what is your agency doing, right? And so they're sharing and things to that nature. So,
and right now they're in a workshop called Stupid Goals. We all know SMART goals. Right now they're learning stupid goals.
Right. It's about building goals you won't quit.
Yeah.
Yeah. You added
really
two
good.
SMART goals. It's really good.
It's really good. Really good.
He's presented for us before. Ryan Green.
I think the first time he presented for us was at one of the spring conferences.
Yeah. We introduced it to the parents and the family service workers.
Yeah.
Or
Stupid goals. Stupid goals are really smart to use.
Yes, they are. They are, because off the top of my head, and I do apologize, they're acronyms. I don't remember, but I know the T is for team.
Yes.
And so when you're putting together goals, you need to figure out who's on your team.
Who's on your team? Yeah.
Because everyone needs
your
a team.
Your support system.
Yeah.
But we can't give it all to you now, because we need you to take the workshop the next time we have it.
Right.
But we'll just give you a little teaser. Stupid goals.
Right. Somebody said, could it be something else? I was like, no, this is what I'm talking about when I say you need to make your workshop titles make somebody go,
what is this?
What is that?
Exactly.
We could do the add-on to SMART goals. And everybody like, I've already been through a SMART goal training.
Right.
Yeah, no. You gotta, this is a tickler into look at the name of your trainers workshops.
And the presenter is really good.
Yeah, he's good.
He's good. So you're going to hear a little bit from participants at the Institute. They'll tell you a little bit about what they've learned, bringing it back to their programs, and maybe a little bit about their programs as well. All right. So stay tuned, listen in, watch us, whichever way you choose, and we'll be back. Ladies and gentlemen, we're here with Erin from Howard County, and she's been with us for the last 3 days at the Health Institute.
It's the Health and Mental Health Cohort Networking Institute.
And the other one is MAPS. Anyway, we won't fall back into that, Erin.
Yes.
How has the Institute been?
It's been great. I actually met a lot of new partners that I hadn't heard their presentations before related to health. We had Maryland Health Connection here. We received a lot of great information about the Peace Project, which is a county-funded project unique to Howard County, but it has a lot of great opportunities for pregnant mothers and birthing people to access resources and doulas, which is an area that was relatively unfamiliar to me when I was having my children. So definitely some great resources, and I always come to meet the other programs and the other directors. It's an opportunity to connect with them and learn a little bit more about how their programs are working through certain topics, things that they're doing really well, and things that they'd like to collaborate on to make better.
You know what I found really interesting about the piece, when they broke down the difference between a doula and a midwife. And they talked about how people just use them interchangeably. And I think I probably was doing that also, So that was really good. They was and the whole thing about helping to support the support system was good.
How do you think you'll use that in your program, or that resource?
So we will likely use it as a practical tool because that program is a referral program, but they also shared tools and resources that our family services staff could potentially use to hold workshops internally, share resources with families as we're familiar connection point. So sometimes people are concerned about signing up for a program or being, tied to a program, but looking at it from the perspective of, yes, we can make referrals, but also how does that add to our knowledge set and how we support those families that come to us every day?
Good. Is there anything really specific from the Institute itself that you're excited to bring back to your staff?
I think I'm excited to bring back to my staff a renewed sense of there's more out there than what we do already. We're a very long-standing agency, and infants and toddlers are brand new to us. And it's an area that we're continuing to learning about the resources in our county, as well as other ways that those families are engaged with younger children. From the health perspective is a big part of it, because those children have much more frequent milestones. We have babies, getting them to the dentist for the first time. What does that look like? Most of our kids, when they were coming to us, were 3 and 4. They've already had their initial dental. So I'm excited to bring back some thoughts on how we continue to infuse those engagement opportunities with our families from the health perspective. And thinking of more ways to weave health into our family engagement. We often think about the core pieces, right? Housing, finance, clothing, food, right? But we don't think a lot about health as a resource in terms of how we preserve it and make sure we're fostering that. Because when our health is good, that's a core building block to build upon those other things like finances and housing and food. And that's where, health is a core piece that we often forget about, especially if we're in survival mode, and making sure that we're maintaining it. So thinking about how we infuse that, going to the doctors or going to the dentist is a really important part about how you as the parent and your child is not just about getting your immunizations and staying on track, but how you as the parent are making sure you're healthy for your family so that you can work, can bring your child to school. You can provide food for your family. You can prepare meals. A lot of it starts with our own health, whether it be physical or mental health.
Yeah.
Right. Yep. So that's right. You guys do have an early head start now, in case anybody don't know. So you have an early head start. If somebody was interested in, seeing if their family qualifies for your program, what should they do?
Sure. So they would just go to the Community Action Council of Howard County website, which is cac-hc.org. We have a section for Get Help that outlines all of our services, including early childhood education. And they can fill out a universal application, which will take in their basic information, and then they'll be contacted by a member of the team to review their eligibility, what they may be eligible for income-wise, and then continue the process from there based on their eligibility.
So you're also telling people don't automatically exclude themselves.
Correct.
Based on what they think. Go put in the application and let us tell you what you qualify for.
Yes, we did also. We have moved to a place where we have posted the Head Start or the federal poverty levels under which Head Start is, so folks could self-check a bit, but we do have programming that is able to extend beyond the Head Start income limits, but to give them a sense of what they might qualify for what age groups. But regardless, we often can evaluate, especially if they're close to a cutoff, and see if there's some ways we can work with them based on other eligibility factors.
All right. Well, Aaron, we thank you for taking the time.
Oh, we forgot to mention that
Oh,
Aaron is a board member
Yes.
Yes,
of
That's
the
right.
Maryland Head Start
Yeah.
Association. So this is your first year on,
it is.
and we're excited to have you.
I'm excited to be here.
Yeah.
We got a lot of work to do.
We do.
Yeah. Yeah.
We do.
But we're ready.
Absolutely.
I won't do it.
Don't do
I
it.
won't do it.
Don't do it.
He's going to do
We
it.
got the
He's gonna do
direction. Aaron, thank you for joining us. And look forward to talking to you later.
All right. Thank you.
And we just happened to snatch Teresa, say your last name for me so I don't mess it up.
Teresa Booker.
Booker. And Teresa Booker is a director. Where are you a director at, Teresa?
I'm a director at Calvert County Public Schools Head Start program.
Okay, so that is great. And so you've been with us for 3 days. How do you feel the Institute went?
I thought this institute was very informational. Lots of good information to take back to the program. Able to think about setting some stupid goals,
Right.
something I've never done before, but a different approach. Got a lot of good information about changes that are happening in the state in terms of insurance, oral health support and resources. So these are all things that we could take back to our families, certainly educate our staff in order to provide the resources that we need in the county.
Yeah, that's great. So Teresa, you are one of the reasons that we started this podcast now. Or you brought it up before. You said you had thinking about doing it for your agency. One other person I mentioned before was Brandy years ago. So we do want to thank you. You are the reason the fire kind of got lit. So thank you so much.
Well, I'm happy that you guys went ahead and pursued this whole idea of a podcast. We have in our library in Calvert an opportunity to do podcasts. We can rent the booth, and I didn't even have any idea how to get started or what types of information. So by doing this, you guys are really setting a model for us, for the programs here, to know that this is something that we should be thinking about. It's a good marketing tool so that our families and the community can certainly know what Head Start is about, different programs, different activities, just school readiness skills in general. We can certainly share with our families. And certainly the information that we've gotten from this Health Institute would be a good way to even start our podcast.
Health and Mental Health Cohort Networking Institute. I've been correcting everybody all week because it is a mouthful. It
Okay.
is a mouthful. And so we got to get used to that and the ham sack. Right. So let me ask you a question. Right now, if someone lived in the Calvert County area and were interested in, learning more about your agency, or if their children where would they, do you have a website? Do they make a phone call? What would you advise someone to do?
So we're unique in that we are part of the Calvert County Public School System. So the first point of contact really is through the school system. We're on the school system's website. We do have our own social media pages as well. We don't really have a radio station in Calvert, so we use our marquee at the Safeway to announce when we were recruiting.
That's
But we-
interesting.
But we do banners during our recruitment season, which starts next month. So that's the way we have generally been getting the information out. We have all of our information out at the libraries and schools and certain places where people eat, get their nails done, get their hair done. So we make sure that our flyers and information are out that way. We also work with Parks and Recs in their local paper that they put out, that we are available. And then we work with the child care programs as well, making sure they know when it's time to make application. But we have a one-stop shopping. So in order to apply for Head Start in Calvert County, they would go to the school website and apply. We are listed as a pre-K program under the school system. So that would be their first stop.
Because that's different everywhere. So that is great information to know. And, I was just thinking about when you just said about, starting the podcast, maybe we can set up something where me and Simeon can come out when you're ready to go to the library and just help you guys get that started.
That would be awesome. We would really appreciate that kind of support from our state leaders, and maybe set the model for everybody else in the state. I
Yeah.
think that would be an awesome idea.
So thank you so much. Thank you for being with us for the next 2 days, for the last 3 days. And so we're getting ready to go head back.
We're getting ready to head back now.
Okay.
Okay, thank you.
Thank you,
Appreciate it.
Teresa.
We spoke earlier a little bit about stupid goals. I didn't want to go into too much depth, but we have Mr. Ryan Green here who came up with the acronym. He's going to talk to us a little bit about stupid goals. Mr. Green, thank you for a great presentation earlier.
Thank you. You know, it was so great to be here. Came in. Stupid goals is my framework on how to set goals that are impossible to quit.
Mhm.
I know most people are familiar with SMART goals, and I was like, well, SMART goals are great, but there's a lot of stuff missing from it. And a lot of people set SMART goals, but you fail at your goals. I was like, well, what's missing from the SMART goals that could help us be more successful in our goals when we set them? And that's where stupid came up from. Obviously, playing with smart, stupid.
Yeah.
You know, and that's what we did today. Had the the centers in there representing the people representing their centers. Really got some good goals, some personal goals, some work goals, some things like that, and really went through the entire process of how to set stupid goals. You know, it's sacrifice, team, uplift. I'm gonna give you just the stew part.
Yeah,
You know, I ain't
just
give you
the
the whole
stew part.
thing.
Don't
You
give
know,
me
I
the
ain't gonna
whole
give you the whole
thing.
thing. But yeah, so it's definitely
Yeah.
I developed this. I want to say maybe at least 6-7 years ago. I think it was before COVID. You know, once COVID came, everything's blur.
Yeah.
But and just really, it's always resonated. People have loved it, and because they didn't think about goals in that way. Some of the things that I put in are what you got to really think about when you're setting the goals to give yourself more success.
Yeah. How have you seen programs or teams, or even a person, an individual, be successful using stupid goals? What do they do different with stupid goals rather than just the smart goals?
Well, the biggest one is really the S, that sacrifice. So I will go deeper in that, because a lot of times we set goals and our personal goals, even though they may impact other people or be around other people, we never think about the sacrifice that we have to make to achieve that goal, or the sacrifice that others have to make while we achieve that goal.
Right.
So I always use the example of, if you're a parent, you got kids who are in sports, and your goal is, have a personal goal that may take you away from being at their activities.
Right.
It's important going into that goal that you spell that out, so you can have that conversation with your kids, have the conversation with the other parent, and say, listen, I'm trying to achieve this goal. It's going to take me 6 months. So I'm going to miss some games this season because I need to go and do this. That way, there's no resentment. That way, it's like, Daddy never came to my games. Like, well, I told you I wasn't going to be there because I was doing this. Now it's up to you to go and do the goal, But I think those things like that sacrifice, a lot of times people, that starts a lot of the argument because they didn't think about the sacrifice until the sacrifice has to be made. So now your wife is mad because you don't go out to dinner no more. Like, well, I told you I was saving money for this, but you didn't tell me this is what
This was the
sacrifice. Biggest thing that people overlook. And once you're in the middle of it, now you're just trying to say whatever you had and make people happy who were upset about it.
Yeah.
And it's too late then.
Yeah, I think that's really a key, a big key, that sacrifice part. And that's not really spelled out in SMART goals.
Right.
And I've experienced that through coaching. I coached high school boys, high school girls.
Yeah, me too.
And they all want to play Division I,
of course,
basketball.
Everybody think they're the star.
Everyone is the star. They want to play Division I, or some just want to play in college.
Yeah.
Right. And so I'll help them develop. Okay, let's talk about a plan. How are you going to get there? What are you going to do? And one of the first things we talk about is the commitment, the sacrifice that they'll have to make to maybe some of their social life, to actually get there. Now they all say, yeah. But not many of them follow through with the actual commitment and sacrifice to reach their goals. So that's definitely, maybe the first key.
Yeah.
And you have that, that's the first thing with the stupid goals. The first key you probably have to knock down in order to reach your goals.
And like you said, everyone will think, even when you're writing, you're like, oh, I'll make that sacrifice. But it's different when you actually have to do it.
Yeah.
Right. And that's the thing. So when you're faced with that, you can say, I knew this was coming. You're not blindsided by it. You still may not do it. You may, okay, I knew it was coming. I didn't realize I was gonna feel like this. I'm not ready to make the sacrifice.
Right.
But at least you're not blindsided and confused in the moment of it when it comes.
Yeah. Is there any kind of follow up to the stupid goals?
Follow up how? Like
just I mean, do you do, like follow up workshops?
Yeah. So one, if you want setting stupid goals. Can I give a website?
Yeah, of course.
Yeah, normally I got a QR code. I don't have a QR code here. But settingstupidgoals.com, you'll be able to get the full training. And with that training, I teach is audio and a video training on how to actually set your stupid goals. But with that, I've gone back. It depends. So organizations might want to call back for follow-ups. Individuals that I coach, we go through the goals, make sure. One of the parts about the goal is having an accountability partner. So a lot of what's built into the stupid goals is that follow-up already, because part of building your team is having an accountability partner.
Okay.
So you always, part of that is having someone who's going to hold you accountable, follow up with you, make sure you're moving towards it.
Yeah. Okay. Well, I really appreciate you taking the time, taking a few minutes to come talk to us. Definitely, doing the workshop. And if you are interested in stupid goals, having them come to your site, your organization, your program, it's settingstupidgoals.com.
That's
right?
It. Yep.
Settingstupidgoals.com. We'll bring it across the screen too.
Perfect.
All right. Appreciate it.
Appreciate you. Thank you.